Hi, I'm Sangeeta and with me is my student Shamali N. Today we're going to do a small speaking sample of OET. For the benefit of the viewers and the candidates who are planning to write the OET, let me just read out the sample card so that you have an idea of what Shamali will be speaking on. The setting is home visit, nurse. A general practitioner has asked you to visit a patient who has diabetes. Until recently, the diabetes has been moderately well controlled by diet and oral medication. However, recently the patient's blood sugars have been high and the doctor has decided to commence insulin injections. The doctor wants you to show the patient how to give herself the insulin injections. On arriving at the patient's home, you find that she is very unsure why she needs insulin injections and very nervous about the procedure of administering the insulin. And your tasks are: 1. Explain to the patient when requested why she needs insulin injections. 2. Explain slowly and clearly the whole process of giving the injection, brackets including using clean needles, administering the injection, sites for injection, etc. Third task, try to reassure the patient that she will be able to manage the injections. And the fourth and last task, emphasize the importance of safe needle disposal and given in brackets, suitable containers, proper care and handling. So this is the task card that Shamali will be performing on. I've already given her the preparation time of 3 minutes, so she is ready to go with the speaking. So as you all know, she'll have 5 minutes for the conversation. So Shamali, shall we begin?
Yes.
Okay, so your time starts now.
Good afternoon.
Good afternoon.
My name is Shamali.
Hi.
I am one of the registered nurses in this unit.
Okay.
I've come here to give some instructions regarding the insulin administration to Miss Mary. So, could you please tell me who is Mary? Because
there's no Mary in this house. I think you're mistaken. Can you just check the name once more?
it is Mary D'Souza.
Are you sure it's Mary?
Oh, it's Maria.
Yeah, there's a Maria and that's me.
Okay, all right. Miss Maria, I've come here because your general physician asked me to come here and to give you some instructions regarding the insulin administration.
Yes, please come over. The doctor did tell me that, I'll have a nurse visiting me. So you're the one, so please come in.
Yes. So, first of all, do you have any idea regarding the insulin administration?
Not really, but I really don't understand why the doctor wants me to have this. You see, I've been controlling my diabetes for so long, just with food and medicine. So why now?
Okay, I appreciate that concern. See, we have just done a blood sugar level recently. So that was very high. And let me tell you the usual, the normal level of blood sugar, that is from 120 milligram to 200. Okay. So yours was more than 350.
Oh, is it something that I should really be worried about?
No, you don't have to really worried about the condition. The good thing is it can be treated with medications. All right?
Like you said, it can be treated with medications. I've been having medicines all the while. Wouldn't it suffice? Can I still continue just the medicines?
But no, I know, as you told me, you've been controlling with the medications and exercise and things like that. But it cannot be controlled with medication.
Oh, okay.
So, what we have decided is to put you on some shots for a shorter period of time.
How is that to be done?
It is only for 2 weeks, and then if we repeat the blood sugar, if we find the blood sugar is normal, then we may stop the insulin.
You mean the injections?
Yes.
I'm really scared about injections.
Okay, I know how frightening it is. Can I know why you don't like to get the injection done?
It's a long story. I've had this fear of injections from my childhood. I'd rather, look for an alternative. Is there any other way out?
Is that because of the pain the injection?
Yes, I think it's a pain and some kind of fear that I've had from my childhood.
Okay, that means you don't like the injections at all.
No, I hate it.
Okay. Okay, so I'll think what I can do to reduce your pain.
Oh, I appreciate that.
Okay, so let me tell you, there are two types of insulin.
Okay.
One is with the bottle. There you have to load the injection and give to yourself.
Okay.
And second thing is a pen insulin comes with insulin itself.
Okay.
There you don't have to load it.
Okay.
So only thing you have to do is just inject the insulin in certain areas. So have you ever heard the sites of injection, or do you have any idea?
No, I don't think I know about it. Could you tell me about where I should?
Of course, yes. There are certain areas where you can administer the insulin injection. The common areas are in the outer aspect of the hand, your upper extremities, and your abdomen, and in thighs also. Okay. I think I can give you a leaflet regarding the details about the insulin administration sites and all that.
Is it a very complex process?
It is not a complex process. Let me reassure you that it is very simple. And the only thing is you have to make sure that the prescription is with you.
Okay.
All right. And as I told you, for the pen insulin, the pain is very less.
Okay.
So there you can avoid your anxiety and your fear.
Okay, so you mean to say it's not an injection at all?
It is an injection, but the pain is very less. Okay.
Oh, okay.
And I've got some disposal things. I mean the bottles where you can dispose the needles after usage.
So are you going to leave the bottle at home?
No, I'll leave the bottle at home. Once in a week we'll come back and take an empty give
What if I'm using the pen?
Yes, I
What if I use the pen instead?
Pen, yes, that is fine. Pen is a single usage. You can throw it after once you use it.
How much will it cost?
It is around $200 to $400. But you are our.
Thank you, Shamli. That's the end of your time.
Okay.
So what you just saw is Shamli's performance on the card that I just read out. And now I'm going to give you the feedback. I hope and I'm sure those of you who've seen this speaking session of Shamli already have come to your conclusions on how she performed, probably already have some feedback that you would like to give her. So when I give my feedback, you can try and match yours with mine. And the best thing about this feedback is I'm giving it based on the latest speaking criteria. That is, from September 2018 onwards, OET will come in its new version, which is called as OET 2.0, and there are certain changes in the speaking criteria. Other than that, the format of speaking will remain the same. So based on the latest changes of the speaking criteria, I'm going to give the comments today for Shamli. There are two aspects in the marking criteria. One is the communication criteria and the linguistic criteria. Communication criteria is the newly added aspects of speaking marking, and the linguistic criteria is the one that already is in place for the current OET speaking. And if you look at the linguistic criteria of Shamli's performance, we can see that she was quite fluent. So it was not too fast or not too slow. The pace was very ample and it was quite good, and that is how it should be. Usage of language, appropriate language use. Now there could have been certain problems that Shamli committed, like if you've noticed when she was explaining the sites of administering the injection, she used a term like upper extremities. And that's probably terms from your nursing notes. Probably as a student you've learned these to write your answers in your answer sheet. But when you speak in your OET speaking, remember you're talking to a patient. Now it is not necessary that the patient will have any kind of medical knowledge or awareness. So you need to keep your language as simple as possible. Okay, so use layman language. So consider the patient has no idea of all these medical terms and aspects. So you need to keep it as simple as possible. So instead of saying upper extremities, probably she meant the hands. So she could have said the upper part of your hand. that would have been much easier to understand. Probably, as if it was an older patient, maybe, or a very young patient also, who has no idea about all these terms, would find it difficult to follow where to really administer the injection. So remember to keep it as simple as possible. That's one. So appropriateness of language, this is my comment I would like to give Shamli. Along with that, earlier in her conversation she said something like, I appreciate the concern. And she responded this way when I spoke about my fear of giving injections myself. So I was not really ready to give insulin injections to myself, and that's when she said, I appreciate the concern. Now probably the word appreciate is a wrong choice there. What she has to say is, I understand your concern, or I understand why you have a problem with injections, or I understand why you're worried, I understand why you're scared. So probably these are the things she should have used. So understand should have been the right word choice. She used appreciate instead. Other than that, if you look at her grammar and usage of expressions, that was quite good. And her accent also, if you look at the aspects of language like the pronunciation part, her accent, it was quite neutral and something that the person listening to can really understand. So on that side, on that note, I would really appreciate Shamli and her performance. And these are the current marking criteria. Now if you look at OET 2.0, linguistic criteria is also added to it, and if we look at that, the first criteria is building relationship. The setting here that I have given Shamli is a home visit, a very apt beginning that Shamli had. She said, I'm so and so, I'm here to meet this patient, your doctor has sent me. Instead of saying, how may I help you, I'm the registered nurse in this particular hospital, those are fixed beginnings. So what you need to remember is, depending on the setting, you need to change the way you begin your conversation, and not only that, how you have a connect with the patient. So she began introducing herself quite well, even when I created an unexpected situation of saying that I'm not Mary, the person she is here to meet. She immediately said, oh, probably I misspelt it, or I read it out wrong, is it Maria? So you have to be ready for such instances where the interlocutor may say, no, that is not the person, or I need your phone number, can you give me the rates, something that you're not prepared with. Even if you get some questions like these, you should be able to handle and respond to that quite well. So the second criteria is understanding and incorporating the patient's perspective, and she did that quite well, where she checked why I'm scared of using the insulin injections. When I said I'm not Mary, she corrected it and she apologized for making the mistake. So yes, so she's letting the patient speak as well. She did allow me to have to express my concerns, and then she was able to give her solutions for that, using an alternative method other than injections, how it can be made less painful. So in that aspect also she did quite well. Then it is the third criteria in the linguistic aspect is providing a structure. Now I would say that she had a very good opening, and the flow from one task to the other was seamless. It didn't really sound like she's looking at a task and then she's stops at the previous task and then she quickly jumps to the next task. So it was quite smooth, it was quite structured. Probably what she could have added to make sure there was a little more structuring in her speaking is to inform the patient what she's going to discuss or what she was about to discuss. Like she could say, now I'm going to talk to you about the different areas where you can inject yourself. So that gives a very clear orientation to the patient as to what to expect from the nurse. So probably structuring in that way would have been much better. So that's my suggestion to Shamli regarding providing structure. And the last two aspects under linguistic criteria are gathering information and giving information. Now when she was gathering information, she did ask the right questions. Okay, now it's very important to learn how to frame the right questions. If it does not sound like a question, you cannot expect the interlocutor to respond to you. So she asked me, can I know or may I know why you are or what is your concern getting the injections done? Why are you scared of the injections? Can you tell me what is the whole worry about? So these kind of questions that you ask will let the patient open up and speak. So you need to make sure you ask the right questions. to get information from the patient. So gathering information also happened quite well, but I would give her a suggestion where, you know, as a patient I kept saying I've been managing my diabetes with medicine and with food. Probably she could, you know, check with me like what kind of food I was having, and you know, those kind of things, to get a little more idea about you know, my habits probably as a patient, and that could have been incorporated in convincing me to use the injections. So if I say, okay, these are the things that I eat on a daily basis, then probably she could say, you know, that should not be consumed, or probably just with food, whatever you're eating is quite fine and it is the right diet for a diabetic patient. But since your blood sugar level is quite high, and she gave a reading which is very good. Now she gave a reading saying this is the current rate, which is quite high. You know, she did that, which is good. So she could have added saying, you know, the current diet pattern will not help control this particular reading, so that is why you will have to switch on to taking the insulin injections as well. So yes, and giving information was quite good, but like I said, probably the usage of certain terms like upper extremities could have been avoided. And have you heard about the sites? That was a question she asked. So there was you know, a good involvement. She tried to involve the patient also good enough in the conversation, and that's also quite important. So there should be a good give and take ratio. It is not that only the nurse should be speaking for a long time, and if you watch our speaking once more, you will realize that both I as a patient and Shamli as a nurse, we both were talking quite good enough. We had a you know, good rapport, and it didn't sound forced, it didn't sound unnatural. So if it is a very natural conversation that you have with your patient, then you're really good and you can get a real good grade in your OET speaking. So these are my comments based on the latest marking aspects of OET. Now match the comments that I just gave with yours and check if you've got a good idea of what the marking criteria are in the updated OET 2.0. If you're still not clear with that, you can watch one of our previous videos wherein we've in detail given what the updated speaking marking criteria are for OET 2.0. So thanks for watching.